All right, this is going to be chapters 37 and 38, hygiene and rest and sleep. So, hygiene, very important, can have an effect on overall health, comfort, well-being, individualized care nursing plan. When they become ill, have surgery, or injured and can't do their own personal hygiene routine, it becomes the nurse's responsibility to meet those needs. So, before you do any care delivery, the first thing you want to do is evaluate the client's ability to participate in any personal hygiene. Encourage clients to participate in any way they can. Integrate assessment, range of motion exercising, and dresses changing while doing the hygiene care. Alright, so starting with bathing. Bathe the clients to cleanse the body, stimulate circulation, provide relaxation, and enhance healing. It's often delegated to assistive personnel, but the nurse is responsible for the data collection and client care. So remember, also, when you delegate to someone else, you're still responsible. All right, so you can bathe clients whose health problems have exhausted them or limited their mobility. You want to give a complete bath to clients who can tolerate it and whose hygiene needs warrant it. A partial bath can be good when the client can't tolerate a complete bath at once, or they just need cleansing of odorous or uncomfortable areas, or they can perform part of the bath independently. Therapeutic baths are used to promote comfort and or provide treatment and such as soothing itchy skin. Okay, so oral hygiene helps decrease the risk of infection for clients living in long-term care facilities, especially transmission of pathogens that can cause pneumonia. Alright. Foot care prevents skin breakdown, pain, and infection. It's extremely important for clients who have diabetes, and a qualified professional must perform it. So we're not allowed to actually cut the nails or anything. God forbid something gets infected. Alright. Perineal care. That helps maintain skin integrity, relieve discomfort, prevent transmission of microorganisms, such as the catheter care. Also can decrease risk for UTIs. Some cultural or social practices. Clients vary in their hygiene preferences and practices. These include bathing routines, oral care, grooming preferences, health beliefs. Culture also plays an important role because some cultures have unique hygiene practices, so you can always ask the client. Socioeconomic status can affect their hygiene status. For example, if they're homeless, try to alter discharge instructions and follow-up care accordingly. And respect the dignity. So they already might be feeling like they have lost some control. So reassure clients and allow them to have as much control as possible, and always cover them in areas that you're not working on. So before starting any care, you must understand how to do all the tasks so you don't injure the client. Never leave a client in a position where injury could occur. For example, if they're at risk for aspiration, don't leave them alone with oral hygiene supplies. Adjust the bed to a working height and lower the bed after you complete the task. For older adults, just remember their skin is drier, thinner, and won't tolerate as much bathing as younger adults' skin. Older adults have a higher incidences of infection and periodontal disease due to weakening of the periodontal membrane. Dentures must fit correctly, or they can cause digestive issues, pain, or discomfort. It's their personal property, so never leave them on a meal tray or in a place where they could be damaged or lost. Dry mouth can be common due to decreased saliva production or the uses of antihypertensive, diuretics, anti-inflammatory agents, or antidepressants. Poor nutrition status is also due to dental problems, socioeconomic status, or limited ability to prepare healthful foods. So assessment or data collection. Inspect the skin color for hydration, texture, turgor, any skin lesions, or impaired integrity. You always want to assess all the skin surfaces, including the feet, nails, the size and shape of each foot, any lesions, drying, inflammation, basically all that PQRST thing. Look at their teeth, monitor for safety issues, self-care, ask about how they perform oral hygiene at home or any other bathing or shower at home, and if we need to educate them with anything else. So giving a bed bath, we pretty much know how to do that, but I'm just going to go through that real quick. Collect your supplies, provide privacy, explain the procedure, use your gloves, lock the wheels, get them into a comfortable working position, place a bath blanket over the client, remove the gown, obtain warm water, wash the client's face first, allowing the client to do that if they want to, if possible. Do it systematically, starting with the client's trunk and upper extremities, continuing to the lower. Keep the cleaned areas covered with a blanket or a towel. Do long, firm strokes from distal to proximal. Use lighter strokes over the lower extremities for clients who have a history of deep vein thrombosis. So that's start with the trunk and upper body. You want to do long, firm strokes, distal to proximal. So start with like the hands and then you move up towards the armpit. Apply any lotion or powder unless any is contraindicated or any order they have for anything. Document the skin assessment, type of bath, and the client's response. So to change linens on an occupied bed, adjust the bed to a comfortable working height. Don gloves. So this book says that you're going to have gloves on to change the bed. Roll the bottom linens of the bottom sheet up. I think we pretty much have that. Apply a plain pillowcase. Turn the pillowcase inside out. Pull the case until it's right side out. Make sure the linens are clean from wrinkles. Apply the upper sheet or the draw sheet and the blanket. Oh, both, I guess. Foot care. So we want to, it's important to prevent any infection or pain that can interfere with gait. So a qualified professional should perform foot care for clients who have diabetes, peripheral vascular disease, immunosuppression, or anything related to the feet, any surgeries, lesions, stuff like that. And they can evaluate the feet and try to prevent injury. So they should inspect the feet daily, paying specific attention to the areas between the toes. You never want to leave those wet. And also don't put lotion between the toes. Use lukewarm water, dry the feet thoroughly. You can apply moisturizer to the feet, but not between the toes. Avoid any over-the-counter products that contain alcohol or strong chemicals on the feet. Wear clean cotton socks daily. Check for any objects, rough seams, or edges that may cause injury. Avoid self-treating any corns or calluses. Wear comfortable shoes that don't restrict circulation. Don't apply heat unless it's prescribed. And contact the provider if there's any indications of infection or inflammation that is appearing. Alright, so now perineal care. So you always want to maintain skin integrity to relieve discomfort and prevent transmission of infection or catheter care. So some principles of perineal care: providing privacy, maintaining a professional demeanor, removing any fecal matter from the skin, cleansing the perineal area from front to back, drying thoroughly, retract the foreskin of male clients to wash the tip of the penis, cleaning from the meatus outward in a circular motion, and then replace the foreskin. So on to oral hygiene. Check for any aspiration risk, impaired swallowing, or decreased gag risk. Clients who have a fragile oral mucosa require very gentle brushing and flossing. Have suction apparatus ready at bedside for clients who are unconscious to help prevent aspiration. Don't place fingers into the unconscious client's mouth because the client could bite down on your fingers. Position the client on their side and with head towards you, either in semi-Fowlers or supine, or I guess flat bed, but they are on their side. That'll allow the secretions to kind of drip out and collect. You can perform denture care for clients who are unable to do that themselves. But again, dentures are fragile, so handle them with care. So you want to remove them with a gloved hand, pulling down and out. And for the lower one, you pull up and out, or place them into a emesis basin or anything like that on a washcloth in the sink. Brush on a horizontal back and forth motion. Rinse them in tepid water, and then store them in their denture cup, labeling the cup with the client's name. You can place them in a cup with water to keep them moist, or reinsert them into the client's mouth, usually by their preference. Nail care. Observe the size, shape, and condition of the nails and nail beds, fingernails and toenails. Be specific. Check for any cracking, clubbing, or fungus. Before cutting any client nails, check the facility policy. Some may require a prescription from the provider or only allow a podiatrist or a qualified professional to cut clients' nails. Foot and nail care vary from the standard when caring for a client who has diabetes or peripheral vascular disease. Do not soak the feet due to risk of infection, and do not cut the nails. Instead, you can file the nails using a nail filer, and don't apply lotion between the fingers or toes because the moisture can get stuck and it can cause skin irritation and breakdown. Alright, so now on to hair care. So caring for the hair and scalp is important for the client's appearance and sense of well-being. It's an essential component of personal hygiene. Take into consideration the client's cultural and personal preferences. You want to brush or comb the hair daily to remove tangles, massage the scalp, stimulate circulation to the scalp, and distribute natural oils along the hair shaft. You can use a soft bristle brush to prevent injury or trauma, or a wide tooth comb to pick through tightly curled hair. For clients who can't shower but can sit in a chair, you can shampoo them right at the sink if they are able to lean back. For clients on bed rest, you can use plastic shampoo tro. Dry or no rinse shampoos and shampoo caps are also available for clients who are on bed rest. So you want to start shampooing at the hairline and work towards the neck. Gently lift the head with one hand and shampoo with the other. Place a folded or rolled towel behind the neck or at the edge of the sink. Rinse, comb, and dry the hair. So shaving now. It's very important. If they are on any kind of anticoagulants, prone to bleeding, low platelet count, don't forget that one, they should use an electric razor to avoid any nicking of the skin. So you want to soften the skin with some warm water. Apply soap. It's not recommended to use bar soap. If you have a shaving soap or a shaving cream, that's best. Hold the skin taut and move the razor in the direction of the hair growth, using long strokes on areas of the face and short strokes near the chin and lips. And you can also ask the client about their personal shaving preferences, just in case they like to keep some of their hair or anything like that. Alright, so now I'm going to go on to rest and sleep. So adequate amounts of sleep and rest promote health. Too little sleep can lead to inability to concentrate, poor judgment, moodiness, irritability, increased risk for accidents. Chronic sleep loss can increase injury. That also. But obesity, depression, hypertension, diabetes, heart attack, and stroke. So the sleeping cycle. There's 4 stages: non-rapid eye movement and rapid eye movement. And then, there's 4 stages of non-rapid eye movement and a period of rapid eye movement. So that's REM sleep. Typically after stage 1 of non-rapid eye movement, people cycle for about 4 to 6 times through the other stages. So non-rapid eye movement is usually about 75 to 80% of the sleep time. Alright, so stage 1, very light sleeping. It only lasts a few minutes. Vital signs and metabolism are beginning to decrease. You'll awaken easily, and you'll feel relaxed and drowsy. So to me, I think that's just starting a nap or something. Stage 2 is a deeper sleep, usually about 10 to 20 minutes long. Vital signs and metabolism are continuing to slow. You require a little more stimulation to awaken, and you are increasing your relaxation again. Stage 3 is the initial stage of deep sleep, about 15 to 30 minutes long. Difficult to awaken, relaxing with little movement. Stage 4, it's called delta sleep. That's the deepest sleep, about 15 minutes to a half hour. Vital signs are low, very difficult to awaken the person. Physiologically, you're doing your rest and restoration. You might sleepwalk or sleep talking, it's possible. Repair and renewal of the tissue. All right, REM sleep is vivid dreaming. I must have a lot of REM sleep. Usually about 90 minutes after falling asleep. It's longer with each sleep cycle, and the average length is about 20 minutes. Vital signs can vary. It's difficult to awaken them, and this is when you're having cognitive restoration. So sleep duration varies with developmental age. Infants and toddlers average about 9 to 15 hours a day. And this decreases through childhood, with adolescents about 9 to 10 hours, and adults 7 to 8 hours. All right, so some common sleep disorders. Insomnia. That is, there's a couple different versions of insomnia. One is acute insomnia, which may last a couple of days, maybe due to a personal or situational stressor. There's chronic insomnia, which lasts a month or more. And some people have intermittent insomnia, which is sleeping well for a few days and then having insomnia for a few days and going back and forth. Women and older adults are more prone to insomnia. All right, another sleeping disorder, sleep apnea. That's more than 5 breathing cessations lasting longer than 10 seconds per hour of sleep, resulting in decreased arterial oxygen saturation levels. So that's stopping breathing for longer than 10 seconds per hour of sleep. So decreasing your oxygen level. There's central sleep apnea, which is a central nervous system dysfunction at the respiratory control center of the brain that fails to trigger breathing during sleep. And then there's obstructive, which is a structure in the mouth or throat relaxing during sleep that can occlude the upper airway. And then another disorder is narcolepsy, and that's sudden attacks of sleep or excessive sleepiness during waking hours. It often can happen at inappropriate times and increases the risk for injury. So PQRSTU again, asking about sleep patterns, history, changes, sleep requirements for them, asking about any problems, best sleep, worst sleep, ratings, the scale, any factors that interfere with sleep. So some factors that can, illness can require more sleep or it can disrupt sleep, such as nocturia, which is having to go to the bathroom in the middle of the night. Current life events, if you're traveling or changing work hours, that can disrupt sleep. Emotional stress or mental illness, diet, heavy meals before bedtime, or caffeine use. Exercise promotes sleep if it's at least 2 hours before bedtime. Otherwise, it can disrupt sleep. Fatigue may make falling asleep difficult. Sleeping environment, it might be too light, the wrong temperature, too noisy, snoring partner. Excuse me. And medications. Some medications can induce sleep, but interfere with restorative sleep. Other medications, such as bronchodilators or antihypertensives, may cause insomnia. So some nursing considerations. You want to help establish and follow a bedtime routine, limit waking the clients during the night for tests and stuff like that. You want to help with personal hygiene needs or a back rub prior to sleep, just trying to get them comfortable. Consider continuous positive airway pressure, so that's the CPAP machine for clients who have sleep apnea. Consult the provider about any other sleep-promoting over-the-counter products such as melatonin, chamomile. But you always want to start with something non-medication related, more holistic. So maybe that's listening to music or turning the lights dim. So at a last resort, you can suggest that the provider prescribe a pharmacological agent. There might be like a benzo or a sedative, hypnotic, such as zolpidem, esopiclone, or Zalfon. Alright, so when you're educating the clients, you can tell them that if you exercise regularly at least 2 hours before bedtime, establish a bedtime routine, arrange the sleeping environment for comfort, limit alcohol, caffeine, and nicotine at least 4 hours before bedtime, limit fluids to 2 to 4 hours before bedtime, so if they having to get up a lot during the night, and engage in muscle relaxation or if they're anxious or stressed. So some client education for narcolepsy would be exercising regularly, eating smaller meals that are high in protein, because carbs can sometimes induce sleepiness or drowsiness. Take naps when they're drowsy, or when narcoleptic events are likely. Take any prescribed stimulants. Avoid activities that could cause injury, such as driving or doing something on a ladder, heights, stuff like that. Avoid activities that increase sleepiness, such as drinking alcohol, warming environments, or sitting too long. So that is the chapter on sleep.